Okay.
Today I'm going to speak to you about autism, the symptoms of autism, and the many spectrums within autism. You're at the hospital, and your first baby has just been born. You look at your child and you see the most beautiful baby ever. You dream about all the things that your child will do. But little did you know that in 3 short years, things would not be as perfect as you had imagined. Every parent looks forward to seeing their child reach developmental milestones, such as, at 6 months, they're sitting up and imitating sounds. At 12 months, they're walking and saying 2 words other than mother and daddy. At 24 months, they're using 2 to 3 word phrases. At 29 to 30 months, they're brushing their teeth by themselves, they may be potty training, and they're feeding themselves, becoming more independent. By 3 years, they have a rapidly growing vocabulary, and they even have imaginary friends. By the time your child is 2, you notice that your child is not performing as other typical children. They're not speaking. They do not play with other children or even seem to notice them. They line up objects in a particular order and become very frustrated when you move one. You may not understand your child's behavior, but after many doctor's visits and several observations, you were told that your child has autism. I became interested in this topic after taking a job in a school working with children with autism. I have worked with children with mild autism and severe autism. Autism is becoming a more common disorder that knows no race, no educational background, no lifestyle choices. It can affect any family and any child. In order to understand autism, we need to look at the definition of autism, the symptoms, and the outcome. The Autism Society defines autism as a complex developmental disorder that appears during the first 3 years of life and affects a person's ability to communicate and interact with others. It's very likely that you have encountered a child with autism. Autism affects 1 in every 150 children and 1 in every 94 boys. According to CBS News, a study done in 2002 showed a rise in autism by 57%. There are various ranges of autism. They range from mild, known as Asperger's, to severe, to a child who does not speak or interact with others. Symptoms of autism can vary with each individual, but one symptom sets it apart from every other disorder. It's a social impairment is what sets autism apart. Autistic children can have some sort of repetitive movement, such as arm flapping or twirling. They may display stimming behaviors. They avoid eye contact. Now that we have a better understanding of autism, let's look at how it impacts the world around us. Autism impacts many children, and the cost can be very high. There are 24,000 new cases of autism in the United States, according to the Talk About Curing Autism. The cost of caring for a child with autism can range from $3.5 million to $5 million. Autism is a fast-growing developmental disorder. While working with autistic children, I have found it can be a very slow process, and multiple techniques can contribute to the treatment, such as staying on task, repetitive work on one thing at a time, responding to a child's sensory needs, keeping a constant location for the therapy, and setting boundaries and sticking to structure. Even continual work and constant therapy can take time with a child with autism. As a leading expert in the field of speech and language, therapist Lisa Stinson said, "There's no single one known cause for autism, but it is treatable." She compares autism to rocks. They come in all different shapes and sizes, and no two are alike. There is no known cure for autism, but it can be treated. Meeting a child's autistic needs is very important, and they respond better to therapy. If the child allows you, you may massage their feet. Do not overstimulate the child. Keep a constant routine and try one skill at a time. We've explored the definition of autism, the spectrums within autism, and the symptoms, all under the autism spectrum. I hope you have a better understanding of this disorder and how to identify it, and what you can do to help.